Hello, my name is Yejun Hong. I'm a medical student in the University of Calgary, and our team is here to discuss radiation retinopathy. The link between ophthalmology and radiology are important. The radiology, as is art of imaging, is to diagnose and monitor numerous ophthalmologic diseases. Radiation retinopathy is a damage caused by the ionizing radiation from the process of imaging that involves the radiation. Radiation retinopathy is an alteration in the retinal vascular permeability after receiving ionizing radiation. This is usually equivalent to at least 30 to 35 gray units, which is also 3,000 to 3,500 rads of radiation dose. It can present as late as half a year to 2 years after the radiation exposure. Let's look at the anatomy of the retina before we move on. When you view the retina through a fundus exam, you may find different parts of the retina. The fovea and the macula is located in the temporal side, and this has the highest concentration of cones that make up your central vision. Optic disc is located nasally, and this is a point of exit for all the ganglion cell axons. The light converting here will not be perceived, and thus this forms a blind spot. The vessels of the retina and both the veins and the arteries can be seen also with the fundoscopy exam. The cross-section of the retina will reveal that the retina itself has lots of different layers that include various different nerves for communicating, ganglion cells for receiving the eventual electrical signals that has been translated from the light signals, and photoreceptors for the translation of the signals themselves are present. The Bruch's membrane is the deepest layer, the outermost layer of the cornea, I should say, and it borders the choroid, which is a supply layer of the posterior uvea that feeds the retina. With the radiation to the body, as you probably know, these harmful high energy beams can cause DNA damage in the endothelial cells in particular. These will cause progressive cell death and the damage to retinal blood vessels. So, if a patient has diseases that cause the vascular walls to be weak from the beginning, they will be more vulnerable to radiation and can develop retinopathy easily from these external stimulations. So diabetic patients who has very complex retinal issues have a lower threshold for radiation tolerance. So some symptoms of radiation retinopathy includes decreased vision. The patient may not experience any symptoms until the retinopathy involves the macula, which is responsible for central vision. Some signs you may be able to observe in patients that may be presenting with radiation retinopathy includes the microaneurysms, telangiectasia on the retina, cotton wool spots from infarcts, hard exudates, and retinal hemorrhages. Macular edema, vascular sheathing, and disc edema can also be observed in severe cases. The differential diagnosis for someone presenting with what looks like radiation retinopathy includes diabetic or sickle cell retinopathy. Along with that, hypertensive retinopathy is a possibility, retinopathy of anemia, which can also become hypertensive, leukemic retinopathy, and retinal vascular occlusions can also be alternative diagnoses. So for patients with suspected radiation retinopathy, do a complete radiation history, so any instances of past hospitalizations or surgery, or indeed X-rays. Pay attention to the radiated field, total dose that's delivered if the patient knows or if there's a record, and fractionation schedule. Do a thorough slit lamp exam, paying attention to the iris and the lens. And you can also do a tonometry for measuring intraocular pressure and gonioscopy to look at the angle between the cornea and the iris. Investigations for radiation retinopathy includes the fluorescein angiogram, and if this is positive for capillary non-perfusion or even macular edema, then there is pathology in the retina. OCT may reveal intraretinal fluid, subretinal fluid, or cystic space. The treatment of radiation retinopathy includes the injection, an intravitreal injection of anti-VEGF agents, such as 1.25 milligrams of bevacizumab. This may decrease the incidence of macular edema. Panretinal photocoagulation of 1200 to 1600 spots with 500 micrometers of diameter per spot may be done if the neovascular complications develop. The prognosis of radiation retinopathy is moderate, and there can be some complications with regards to radiation retinopathy, like cataracts, macular edema or ischemia, optic atrophy, and vitreous hemorrhage. So here is a summary table of everything we have talked about with regards to radiation retinopathy. And this is a reference from which we have pulled the information to put together this presentation on radiation retinopathy. Thank you for watching this video.